Welcome to The Breakdown with INFB. We're your hosts, Garrett Kelly
and Heidi Gant.
On today's episode, we're digging into one of Indiana Farm Bureau's priorities, which is rural viability. And a main factor in that is healthcare and access to healthcare. There are currently 54 rural hospitals in Indiana, according to a July 2024 report from the Center for Healthcare Quality and Payment Reform. The report said that due to financial losses and low financial reserves, at least 5 of those hospitals are at risk of closure.
Our guest today is well aware of these issues as she serves as Indiana's top doctor. Among her many roles, Dr. Lindsay Weaver is the Indiana State Health Commissioner, adjunct assistant professor of emergency medicine at Indiana University School of Medicine, and an emergency medicine physician with IU Health. So welcome, Dr. Weaver. Thank you so much for joining us today.
Yes, thanks for having me. I appreciate it.
Dr. Weaver, let's get started. So many people might, know you as the Chief Medical Officer for the Indiana Department of Health during the pandemic, a role that you kind of just started before the world shut down in 2020. Since then, you've taken the role as Health Commissioner this last year. So can you talk a little bit about your experience these past few years at the helm of Indiana's public health initiatives, and how do you think we're doing as a state overall?
Yeah, it's been a wild ride. So in my defense, I accepted the position in December of 2019. So before I knew what I was walking into in February of 2020. For the first 2 years, it was all in, with the pandemic. Really making sure that Indiana had the resources that it needed for all Hoosiers to access testing, care, et cetera. So I did a lot working with our hospitals, our rural communities, big business and small business across the state as well. Again, just to answer questions, make sure we are getting information out of there. And I will say, to me, that has been the silver lining. There's more than one, but one of the silver linings that have come out of the pandemic is that we have formed these bonds, these relationships with our private and other public partners across the state. And I think that's where we did so well. I mean, we had people step up and really just say, what do you need? And then be able to figure it out. So whether it be an insurance company coming forward with a tech solution, or Eli Lilly coming forward and say, hey, we can do testing for you, manufacturing saying, we'll, help with making masks or gowns or testing supplies. It really was a all hands on deck effort. And Indiana rose above the rest when it came to that. When I talked to my other state partners in other states, they just weren't seeing that same level of collaboration. So I'm proud of the work that we did in that space. And that's what we're going to take in moving forward, because we still have health outcomes, health metrics that we need to address here in Indiana. They were here before the pandemic. No surprise, they're still here. Some of them have actually gotten worse over the last several years. And it's not just the State Department of Health, local public health, not just the hospitals, not just the, doctors across the state. It's really going to take all of us coming together to solve these problems.
And that's a great point. So I know it sounds like that Indiana spirit of everybody coming together. And I think one of those issues that you talked about that we had before the pandemic and just kind of continues to not be great for Indiana is our rural communities are really losing population and losing hospitals and health centers. But health services and costs continue to be really tough on those communities and difficult, and really any size communities, but I guess really focusing on rural communities. What do you see as a solution, and not necessarily just for Department of Health, but for the state as a whole?
Yeah, no surprise. Everything is multifactorial, but we have seen many hospitals close in our rural communities, and we've also seen them decrease services. One that we're paying a lot of attention to right now is OB delivery. So, hospital-wide, they maybe didn't shut their doors. They said, we're not delivering babies anymore. And that's really essential to a thriving community, is to be able to have that access for women to go to get the services they need. And then, of course, go there to deliver their babies. And we're going to have to come at it from multiple different areas. Some of the things that we're doing at the Department of Health is that we have started a health workforce council. It was one of the recommendations that came from the Governor's Public Health Commission. just acknowledging that there's some really good work when it comes to workforce and workforce retention that's happening, but they were happening in silos. And so it's, let's bring those together. Let's really zoom out and say, okay, where do we need doctors? Where are our gaps? Where are risks, right? I heard you mention earlier that some of our rural hospitals we know are at risk of closing, and what do they need to be able to maintain and thrive? Some of the other work we're doing is, again, it's that zoom out and saying, okay, whether you have a hospital in your community or not, is everybody in that community able to access that care? And if they're not, what are the barriers? And then how do we identify and fill in those gaps? But yes, it is going to take the hospitals coming to the table. We now have our local health departments helping us identify these issues and solve problems, and bringing together community-based organizations and resources from lots of different areas to help solve it. And we're seeing some really exciting and unique things happen. And I would say especially in our rural areas where, because it's a smaller community, they know the players, right? They know who has what resources, and they're coming together to evaluate what the needs are and then make a plan for the future.
That's great. So speaking of some of those gaps, do you think virtual care could maybe, or is already maybe filling some of those gaps? One of the things we see a lot of traction on our offerings at Indiana Farm Bureau Health Plans is teledoc for some of those more common medical conditions that people can speak to a licensed provider for. So kind of what are your thoughts on the world of virtual as far as care goes?
Yeah, absolutely. It is going to play a role, and we still have a lot to figure out, what exactly that looks like. There is something important about being able to be face to face with the clinician, right? For me as a still practicing doc, I need to be able to do my exam, but there are things that can be done over telehealth. And that's something else that we saw really accelerate the capabilities and the abilities there throughout the pandemic. I mean, even the fact that we're, doing this over Zoom right now, we've seen investment in this space, and I expect a lot more to come. And people often think it just comes down to, oh, can I see my doctor over telehealth, right, on my phone or a computer, et cetera. But it also allows specialists to provide support to smaller hospitals that maybe don't have a specialist there. So an example of that would be stroke care. So if someone comes in, has a potential stroke at a rural community hospital that doesn't have a neurologist, well, they can utilize telehealth for that neurologist who maybe is in an urban area to, talk to that patient, learn more about it, review, so that they can make a plan, which would help people stay in their community rather than always the default being to transfer them to a higher level of care or to another place. So it's going to be exciting, and I think it definitely will play a role.
It's a great point about the limitations on, diagnosing as far as examinations go. I think a huge one for people in the rural areas is maybe, connecting with some mental health professionals, which has blown up since then. So good points.
Yeah. So let's talk about this Health First Indiana initiative. So can you explain what that is, and can you kind of give us an update on where we're at with that now?
Yes. So Health First Indiana is really what we're calling just a change in the way that we're approaching public health in general in the state of Indiana. So a lot of people are tying it, just to the funding that was made available from our legislators for our local health departments to address public health initiatives. And that is a huge part of it. And I will definitely get into more details around that. But what I want people to understand and think about is that really Health First Indiana is saying, we acknowledge that we have some poor health metrics, right? We have high obesity, high infant mortality. With the obesity comes diabetes and hypertension and risk for stroke and heart attacks. And those have unfortunately just been getting worse. We've seen our life expectancy over the last decade go down in Indiana. And there is as much as a 10-year difference depending on where you live in Indiana. And often those low life expectancies are in our rural communities, right? So this is us saying we've got to do something different, and let's move into the space of prevention, right? Who's really getting upstream of all these problems, right? Our healthcare system is there to treat the diabetes and the hypertension and all these other problems, but who's really getting in front of it and saying, what can we do to prevent somebody ever getting to that space where they need the healthcare? And that is what Health First Indiana is. And that's what I said the silver lining was bringing people together in the collaboration. That's where I really need, my businesses to be at the table across the state, and our hospitals and our healthcare providers to really engage and invest in that space. But a big part of that is, okay, well, what does this look like actually on the ground? And so coming out of the Governor's Public Health Commission, there was the recommendation and the acknowledgement that our local health departments have been underfunded for a really long time. So they've been receiving the same, amount of funding for 20 plus years. And we know that the need has everything, it's just increased over that time. And it's acknowledging that the people who know best what they need in that community is that community, right? And I would say, especially in rural communities. So in Indiana, 70% of the funding for local public health came from local tax dollars or local revenues there, right? Which is really leads to a disproportionate amount of funding available for our rural communities that don't have as many people and the tax base to be able to do the services that they need, right? So the state coming in and saying, we're going to appropriate, it used to be $6.9 million a year. And this year it was $75 million. Next year it's going to be $150 million. So in 25, it'll be $150 million, a 1,500% increase in funding. That the state has a role in this, has a bigger role to invest into our communities so that they can provide, the basic needs that need to happen everywhere. Because some of our health departments have 1.5 people, and they were just doing the bare minimum. And then you had other health departments that were able to provide a lot of services, right? Because they just were able to generate that more funding just based on their tax base. So it really has been a shift in how we think about things. And I always think about Senator Kenley, who over and over again, when we were talking to legislators about this funding, said this was the biggest investment in rural Indiana that he had seen since he had been a senator for so long.
It's incredible. You kind of mentioned the need was always there and needs growing, but I think probably the pandemic really put that out in the forefront when you have 1.5 people working at some of these local health departments on something that touches, everyone in the state. So it's just kind of key takeaways on some of those local health departments you've visited so far. Are there common issues other than those couple you mentioned that they tend to deal with?
Yeah, I mean, the pandemic definitely it shone a light on where the issues were, even though we knew it. It did. It underlined it, it scored it, it bolded and said, okay, we need to do something different. Because where Indiana didn't do well is that we did have a lot of people, die, be hospitalized, et cetera. And then when you look at it, all those risk factors that I talked about before, like having diabetes, hypertension, obesity, increase the risk for those things. So again, what are we doing to really go back and get in front of that? And I think our rural counties have been some of the most successful in thinking about how they're going to utilize this funding to make a difference. Really, really exciting work. The other thing that part of this is that the expectation is that they use data to drive their decisions. So we at the state are helping the local health departments look at their data and say, okay, you have a high infant mortality, but what's driving that infant mortality, right? Maybe it's substance use disorder, which we know it is in some communities, right? So unhealthy mom ends up having baby early and then baby sick, et cetera, right? In some it's smoking. So we have a county that moms during their pregnancy are smoking at a rate as high as 20%. And then you'll go one county over and it's 2%, right? So if I was that county with the 20%, okay, let's focus some effort and some funding around there to make sure that these women get resources, right? And we're talking about, the risk that it has for your baby if you smoke during pregnancy. We've seen trauma and injury prevention work, whether it be recognizing that, they've had a lot of fatalities or injuries from not proper use of child safety seats, or in another community, they said we have a high number of drownings. So they're investing in making sure that there's swim lessons available or life jackets at the lake or signs on the creek or whatever it may be. But every community, we're going to see 92 counties, 92 different ways of doing this. I've been to, I'm 2/3 of the way there. By the end of the year, my hope is to have visited all of the counties. And that's the other cool thing about Health First Indiana is that we learn from each county as we go there, what are they worried about? What are they focusing on? And then we're able to take that to the next county over, right? So you asked what are some of the themes that we're hearing and common themes. I will say substance use, mental health, suicide has come up quite frequently, which interestingly is not even listed in the things that for the local public health to do. But what they are able to do is to bring resources to whatever the issue is, right? And then kind of recognize, all right, who's doing what or who's not doing something. A lot of times it's like, well, we have these resources in this one town in the far corner of our county. How do we get those same resources to the other corner of the county? So they're able to help facilitate some of that work.
That's great. I love that. So shifting gears a little bit. So at
Mhm.
Indiana Farm Bureau, a really big priority for us and something that we focus on year round is legislation and policy. So
Mhm.
we're really gearing up for the upcoming legislative session, 2025 budget year, which is always a big deal. Are there any specific legislative pieces that you would like to see passed this year? What are some of the Department of Health's priorities for 2025?
I think the biggest clearly is we need to continue to invest in Health First Indiana. The counties had the opportunity to opt into this funding. So the local elected officials said, yes, we want to be a part of this. They have the list of the core public health services. And just in the very short beginning, I mean, the funding just came out here in 2024. We are seeing it make a difference in local communities. But we're not going to see that big difference, right? That decrease in our statewide obesity, changes in infant mortality, decreases in trauma, et cetera. It's going to take some time. Even though we're seeing it at that local level, those big numbers, the statewide numbers are going to take some time. And it's going to take a continued investment. Something I keep on, the words I keep talking to my team about and others is that we have to stop admiring the problem, right? So if we don't continue to invest in this prevention, then we're back to just sitting back and being like, yep, our health metrics keep on getting worse. Our healthcare costs keep on getting worse. And so this is really us saying we're going to do something different here. We're going to get in front of it and we're going to need to invest in it. I mean, last year when I presented this to the state budget committee, one of the legislators said, so you're talking, this is going to be a 5 or 10 budget cycle investment. And the answer is absolutely, right? We need to double down on Indiana. And this will affect everybody, whether you see it directly or not. But I do think, and I hope some of your listeners today, they have seen this investment with their own eyes working in their community, whether it be a health screening event, right, where people can come get their blood pressure checked, check for diabetes, a baby shower for expectant moms, or maybe some of this work around swim or drowning prevention to help get more swim lessons out there. I know even in some instances they're like, what can we do around farming accidents, right? Like what education, what support? Oh, another part I haven't even talked about all this is simultaneously, the legislators invested in us improving our trauma system across the state. So also a big part of Health First Indiana, just recognizing that higher risk of morbidity and mortality in our rural communities, just distance, getting to where they need to be, making sure the people there are appropriately trained and there's good coordination and there's EMS available. So that's kind of a whole other side part of this bigger work.
It's a great perspective on on what's being done at the state level, Dr. Weaver. So if somebody's listening in one of those rural communities and maybe they've got an idea that might improve the health initiatives in their community, kind of at the grassroots level, somebody who takes an interest in that, or maybe a group of people, what's kind of a good way to start, maybe get a ball rolling on one of those initiatives, get the attention of the people who need to be thinking about
Yeah. Yes, great question. We need people to come to the table, and your voice is important. Our local health departments, many of them are having listening sessions. They are bringing together community members and community partners to be able to talk about what those needs are, and ideas are coming from really creative and different places. So whether it's reaching out to your local health department, looking for those opportunities with the health fairs, or our health departments went out to all the county fairs as well, so they should be out and about in your community. So touching base and just saying, either excuse me, I have an idea, or what can I do to help, would be very much appreciated. And if you do see it making a difference in your community, I do encourage you to talk to your local elected officials who opted into this funding. Thank you for opting in, and I'm seeing it make a difference. And then especially your state representatives, right? That, hey, this matters to me. And it's not just, that's the other important thing about this, right? We're not just investing in ourselves and our current ability and access to a healthy environment. It is also for our kids and for our grandkids. I mean, this is a generational investment too.
Yeah, that's a great point. We always try to get our members to the state house during legislative session, because legislators want to hear from their constituents. They want to hear what those issues are, and they don't just want to hear it from our lobbyists. They want to hear it from their own people. So that's a great point, and hopefully people will be coming to the state house this session and really advocating for better public health. So in kind of wrapping this up, Dr. Weaver, looking ahead to this next year, 2025, or even the next couple of years, I know you had mentioned really funding for some of these health first initiatives. Do you have any big goalposts that you want to achieve over the next couple of years? Maybe that's making Indiana higher up on the list of, we better in public health than we have been of other states, or what does that look like for you? What are some of your goals?
Yeah, so many. But a couple things. So we never before have really come out and said, here's where we're at with these health metrics. And this is where we should all be hoping that we be in the future. And we're going to have these statewide level key performance indicators by the end of the year. So you'll be able to go on our website and say, our infant mortality right now rate is 6.6 infants die for every 1,000, right? Our goal is we want to be to, and I'm making this up, but 6 by 2028. And then it's pulling all together, all the partners, and like I said, the businesses, the hospitals, the local communities, everybody across the board to say, what are we all going to do to work on that number? So we're going to have all of these laid out there. So I think, we're bringing together a group of people to do this state health assessment and look really clearly at our health right now in Indiana and say, okay, here's where we're at. We have some funding, we have the initiative, we have the partnerships, we are Hoosiers, we know how to get things done. Where do we want to go, and by when do we want to get there? And so kind of bringing everybody there. I've talked about infant mortality, and I think a lot of people, if maybe your kids are grown or you're out of the having baby stage and you're like, where's my connection there? Infant mortality is actually a direct reflection of the health of your community. So the healthier community, the healthier or the lower your infant mortality rate, because there's lots of things that are going into that, right? It's transportation, it's access to healthcare, it's making sure people aren't using substances, it's healthy moms, healthy families, and so there's a lot that goes into that investment in that space. So that just kind of give a little bit of background there. And I think too, what I'm really excited about is that we have a trauma system plan now. We know where our gaps are in our trauma care across the state, and we have a direction to go to. So 2 years from now, 5 years from now, I hope that we look back and said, we have held to our goal to be data driven, to move forward. We're implementing our plan, and we're starting to see a difference.
Sounds like a long road ahead of us, but ready to kind of roll up our sleeves and get to work there. Dr. Weaver, before we let you go, is there kind of a central place or a website you'd send people to maybe find some basic resources or things that can help them out?
Yeah, thanks for asking. healthfirstindiana.in.gov has all this information about Health First Indiana. The best part about it is that no matter where you live, you can zoom in and find out what's happening in your county, in your community. So go to the website. You can go to, it says your county info. You'll be able to see our key performance indicators on there. We also have a health outcome dashboard where we rank every county 1 to 92, 1 being good, 92 meaning not good health metric. So you can see where you rank amongst the other counties, and every county is different where their issues are, and that's where you should really see your local health departments implementing their funding and doing the work there. And then also shows what are the partnerships, what are our priorities, the county's budget, so how they plan on spending the funding is all on there, and we're going to continue to update it, and plus success stories. So even though we know it's going to take some time to really move the needle on some of these big metrics, like I said, it is actively saving lives today. And I've heard some really great stories as I've come out and visited all of your communities. And maybe someone listening has been there when I've come out and visit. Thank you for taking the time to do that. It means a lot to me to be on your soil, in your community, hearing directly from you about, what your needs are, what your hopes, your dreams are, what you're excited about, what you're worried about. And like I said, we take that to heart. We take it back. We're sharing that with other counties and communities. And it's really important to us. It's been a blast. I've seen such beautiful places of Indiana. We've eaten some really good food and some hole in the walls, which have also been amazing. And I feel really lucky to be a Hoosier. I feel lucky to be in this role and to be able to serve the state in this way. So thank you.
Thanks so much, Dr. Weaver. I really feel from your positive energy that we're going to do some great things over the next few years, and we appreciate you working for Hoosiers and doing that for us. So we appreciate your time today.
Yes, thank you guys so much. I appreciate it.
If you enjoyed our conversation today, make sure to subscribe to The Breakdown with INFB and even rate and review us to let us know how we're doing. For more information, visit www.infb.org/podcast.